How to ask an answerable question. This is video 2 of the Ask module. The following slides will advance on their own, but feel free to pause or rewind as many times as you need. We are at step 1 of the evidence-based nursing practice process, asking answerable questions. In video 2, we're going to learn how to ask clear and answerable search questions. We will learn about the components that make up a good question, key concepts, and how we identify them. It's important to understand that a patient scenario or a clinical practice scenario may include several search questions. A research topic may also include several search questions. And this is also true for continuous quality improvement, or CQI, and questions related to implementation. To find answers to your search questions, you need to say what you are asking clearly. Each of your search questions should be formed separately, as each will include different key concepts. Key concepts are important because your search will be constructed using your key concepts. It may seem obvious, but the key concepts for each of your questions will be different, and so each question must be searched separately one at a time. We'll talk more about key concepts later in the video. For this video, we're going to work from a clinical practice scenario, like the ones you may use in class or practice. You can pause the video now and take your time reading this scenario, or you can print the scenario. You'll see that there's a link to a PDF version of it below this video on the module. We're going to use search questions that are contained within the clinical practice scenario we just saw. Let's begin. So what makes a question answerable exactly? Well, an answerable search question is formed with your literature search in mind. It contains the key concepts or ideas that you can use to build your search with. These are the main ideas contained within your question that you will need to include in your search in order to find articles on your topic. These are important because without correctly identifying your key concepts, you will not find what you are looking for. A good question should include information about your patient or your population that you're interested in, the specific test or procedure or intervention that you wish to know about, a specific test or procedure or intervention that you wish to compare it to, although you are not always comparing, information about your desired outcome, information about timing if this is important, and information about the situation or the context if this is important. These will be your key ideas or concepts. But keep in mind that not all questions will have information about all of these things. and not every detail needs to be included as a concept. So let's look at these elements one at a time. When you're thinking about your patient or your population, ask yourself, is age important? Would the intervention work differently for a different age group? For example, are you working with the geriatric population or just adolescents? If that's the case, then include this information as a concept. You can also ask yourself if sex is important. Does the same apply to both sexes? For example, is the fact that your patient is a woman important? If yes, include this as a concept. It's important to note, though, that if sex-specific info is already included in your question, for example, you're asking about ovarian cancer or erectile dysfunction or prostate cancer, there is no need to include sex as a separate concept, because each of these things can only occur in either a man or a woman. Sometimes you're asking a question about a specific population, and so you should ask yourself, is a profession important? Is your question about nurses, or could it apply to all health professionals? If it's just nurses, then include this in your question. Again, if the nature of the thing you're asking about is already nursing specific, or you're in a database that includes mostly nursing research, for example, CINAHL, there is no need to include profession in your question or as a concept. Another question to ask about the patient or population is, are you asking about a specific patient group or a specific diagnosis? So for example, do you want information about patients diagnosed with diabetes, or patients experiencing a recurrence, or only inpatients? If this is important, include this information in your question. Now that we have information about our patient or population, we need to include information about the test or procedure or intervention that we want to look for. Now, these words are very broad, and so we're going to have to get a little bit more specific in order to find information. So for example, you can ask yourself, are you interested in tests to screen for depression? And if that's the case, include that information in your question. Are you looking for a psychosocial intervention? Include that information in your question. If you have a specific psychosocial intervention in mind, then include that. Be as specific as possible. The next, you want to think about your desired outcome. So ask yourself, what do you hope to achieve? Do you want to reduce pain, prevent infection? Do you want to increase adherence? Do you want to have a successful treatment, a shorter length of stay? If so, include that information. Sometimes timing is important, so ask yourself, does how often or when you do something matter? And if so, include it in your question. So for example, if you're wondering when to remove a urinary catheter, or how frequently to change bandages, or how soon to get a patient up and moving, then include that in your question. Sometimes context is important. So ask yourself, does where it's happening matter? And if so, include that information in your question. So for example, if you're looking for information about an intervention that would happen only in an intensive care unit or only in a community clinic, then that would need to be included. A good question finds the balance between being too specific or narrow for someone to have researched it, and too broad for it to be useful in your searching. So here are some examples of what might be too broad or too narrow. The question, what are ways to prevent urinary tract infections, is quite broad. It also happens to be a background question. If you need a refresher on what background questions are, watch video 1 again. Why is this too broad? Well, that's because probably there's going to be a lot of articles on this topic, and there may be many, many, many different ways to prevent UTIs. So you need to get a little bit more focused here. On the other hand, you don't want to go too narrow. So if we're asking if the use of silver oxide-coated urinary catheters to help prevent catheter-associated UTIs in critical care units in Montreal teaching hospitals, that's a little bit too specific. It would have to be that a research team had specifically asked about all of these details. And it may not really be important that this is happening in Montreal or that it's a teaching hospital. So consider that as well when you're asking your question. A question that is just right is, does drinking cranberry juice help prevent urinary tract infections in women? You've got your population, you've got your intervention, you have your outcome, and so you have just the right information to start searching for articles. To do that, all you have to do is look at your question and circle the main ideas. We do this because key concepts will determine the keywords that we end up using in our search. So for this example question, is cranberry juice effective for urinary tract infection prevention in women? The main concepts or ideas are cranberry juice, UTI, prevention, and women. Here's another example. So for the question, in recurrent urinary tract infections, are probiotics an effective treatment? Your key concepts would be recurrent urinary tract infection, probiotics, and treatment. And here's a third example. Is levofloxacin as cost-effective as ciprofloxacin as a urinary tract infection treatment? So in this case, you would have your concepts: levofloxacin, cost-effective, ciprofloxacin, UTI, and treatment. It takes some practice to learn which words in your question represent the key concepts and can be searched. The more you search, the easier it will be to know how to ask answerable questions. Eventually, it will become second nature. Key concepts are the key to good searching. And in the Search Module Basic, you will learn how to begin planning a search using your key concepts. If you need more help, you can register for a library clinic or book an appointment with your liaison librarian. And you can do both from the Nursing Subject Guide or specific course guides, and the modules. Please try to complete all the modules before booking an appointment. You may find that many of your questions are answered by watching the videos and reading the additional materials.